Today I'm talking to Catherine Himsworth, who has just published some very interesting research on homeless people.
We wanted to concentrate mainly on the trimorbidity of homelessness, which is looking at chronic disease, mental health issues and substance misuse and alcohol problems, and really make sure that we looked at these issues in a very broad way in the GP record, because it's the complex interplay of these different elements of the homeless people that really play into each other and can often make them very unwell. The trimorbidity of homeless health predicted unplanned hospital admissions in this population more than fourfold. So just to put that in simple terms, patients that have a diagnosis of a substance misuse issue, a mental health issue and a chronic disease are actually almost 4 times the risk of having an unplanned overnight admission.
If you were talking to GPs, what would you say to them based on the work that you've done?
The way you work with patients in that sort of practice is that every single person has a holistic view of the patient, working with them without judgment, realizing that the complex issues around, their state of homelessness at that time, their mental health, what substances they're using or not using, their chronic diseases and how they're being managed, they're all playing into each other and creating a vulnerability in that patient. But particularly a scoring system developed through some kind of risk stratification tool would start to pick up the patients that are perhaps not obvious to the clinical team. So the patients that don't shout the loudest but potentially are really at risk of becoming unwell. And don't forget, homeless patients don't just need to be street homeless, they could be just patients that are vulnerably housed. You perhaps want to start looking at more broadly at trimorbidity as a marker for predicting that these patients are going to become unwell. So if your patient has a diagnosed chronic disease, if they have mental health problems and substance misuse problems, then this is potentially a marker that you really need to be working closely with this patient to improve their chances of a good health outcome.